morning. Thank you so much for being here. Really appreciate it. My name is Tom Workman. I'm a principal researcher with American Institutes for Research, and I am delighted to have with me two of our favorite patient advocates, I guess I'll call, Casey Quinlan and Jeanne Pinder, who's just done a phenomenal job working with us on a project I'm going to share with you today. And also with us is Paul King, who is also from American Institutes for Research. Paul leads our client-facing technology group and has been a wonderful proponent working with us on some of the technologies of our work. I want to give you a little bit of an overview, and then we're going to treat this very much like a panel discussion and invite you into that discussion. But there are a few things I want to show you just to give you a context, and then I'm going to have each of the panelists sort of present a little bit about their own thoughts and ideas around this subject. To be clear, what we have discovered, and it's been a passion of mine for quite some time, has been the inclusion of patient and caregiver stories in ways that help really build policy change and really change the way in which we do things. One of my favorite things about the Medicine X conference is all the stories that we get to hear from the main platform. Some of them are very moving. All of them are quite profound. And yet, they don't always have the opportunity to create the kind of practice change that we're all most interested in creating. And so we've been spending time at the American Institutes for Research figuring out how we could do that. We did that through a process that's going to come out to be this product, which you'll see by the end of the month. We'll be releasing this nationally in the end of the month. This was a 2-day convening of stakeholders across the country. People who worked at the American Hospital Association, payers, funders, clinicians, patient advocates. We had quite a wide array of stakeholders come together for 2.5 days and really develop a roadmap of what would it take, what would it look like for us to actually activate patient engagement. And we were interested actually in 3 scenarios. The most common one that we all seem to talk about is how do we get patients engaged in direct care? Important, but certainly not enough to really create the kind of changes we need. We're interested in how to get patients and caregivers involved in organizational design and governance. How do we get patients on boards, on panels, helping to make decisions about the way in which we accomplish things? And then finally, how do we involve patients and families in public policy? And in really creating the kind of public policy that can support. So engagement to us is a very broad concept based in partnership, and we brought together 60 people across the country, including Casey and Genie, to come together and help us sort of figure that out. The result of that is going to be a very easy to use, very specific roadmap of 8 major strategies, things people can do today to start to change the nature of patient engagement. I'm very excited about it, and I'm excited about it coming out. So one of the things that we did, though, to inform this meeting, we started working months before the meeting, is that I got Dave deBronkart, ePatient Dave, Casey, and Genie to join me on a little adventure where we went online and asked patients and families to share their stories. And we asked specifically, what do you want to, what is a good example of a partnership? And when have you had a situation with a doctor that you felt was a partnership, and when didn't you? Tell us that story. And we collected stories from literally all over the country. We spent time, I'll talk about the process here in a second, but what's most important is that we look to create a collective voice across stories. And to answer the question, what do patients and families want? The answer to that question became the basis or the vision for the roadmap. And so again, it had a very collective impact. And I want to show you, we made a whiteboard video to try and capture the vision, and this came straight out of patient and family stories. And guess what? You guys get to see it first before it really is done. So it'll actually come out later this month.
Patient and family engagement in healthcare is at a crossroads. Over the last several decades, we've accumulated significant evidence about the compelling benefits of engaging patients and families in their care. For example, at a leading medical center, implementing patient and family engagement strategies on one hospital unit led to a jump in patient satisfaction scores from the 10th to the 95th percentile. And in a study of tools designed to increase patient engagement in healthcare decision-making, the use of these tools led to patients getting care that was more in line with their preferences, and an average 43% decrease in the overall costs of care. But despite evidence of its value and benefits, meaningful patient and family engagement remains the exception, not the rule. What would it look like if this changed? Picture this. Patients and their families are active participants in their care, working in partnership with clinicians. They are prepared and have support to engage, including knowledge and information about their health, conditions, illnesses, and diagnoses, and what they need to do to stay healthy. Healthcare organizations use technology to increase transparency and facilitate information sharing via portals that give patients full access to their electronic health record and clinical notes, and the ability to communicate with their healthcare team. Healthcare decisions occur through meaningful conversations among patients, families, and the healthcare team. Patients' preferences and opinions are elicited and considered, along with medical research and guidelines, in decision-making that helps patients accomplish their health and life goals. Patients are encouraged to communicate with their care team in ways that match their needs and preferences. And the system recognizes that not all patients are alike, tailoring communication to individual needs and addressing issues of language, literacy, and cultural and ethnic diversity. Patients and families also have an active voice in shaping the way care is delivered. They serve as patient and family advisors, sharing ideas about how to improve care. They participate on quality and safety committees and have access to organizational quality and safety data. They serve as healthcare organization board members. They are partners in determining organizational policies and procedures and establishing a culture that fosters continuous improvement and innovation. This type of real organizational change benefits everyone. For example, when patient and family advisors guided the development of a neurology and neurosurgical center over 3 years, there was a 62% reduction in medical errors. This vision of patient and family engagement extends beyond any one care setting. Patients experience effective coordination, seamless transitions, and continuity of care as they move between care settings. Assisting these transitions is a strong link between the healthcare delivery system and the communities where patients and families live. Community needs are respected, and community resources are used effectively. Finally, this vision of patient and family engagement extends to public policy, where patients and families help make sure national, state, and local policies and programs reflect the needs and interests of patients and families. This means patients and families have open access to policymakers and are included on committees that implement policies and programs. When all of these things happen, we shift our paradigm from a medical model of care to a person-oriented model of care, from a system that focuses on treating illness to one that promotes health, from a system that does to and for patients and families to one that does with them. And we take big steps toward achieving important outcomes: better health, improvements in patient safety and quality, lower healthcare costs, and better experiences of care for all parties: patients, families, and clinicians. Is the vision ambitious? Yes. Achieving it requires all of us working together in clear and coordinated ways. The roadmap for patient and family engagement in practice and research helps organize our efforts, illustrating pathways for creating meaningful partnerships, describing key milestones, and listing strategies and tactics to advance the work of patient and family engagement. We invite you to join us as we work together toward a new vision of healthcare.
And again, Don't share that with anyone for another 2 weeks. But hopefully it gives you an idea. That vision was created in a white paper, and again, we found a way to visualize it to put it back into the roadmap so we have the context, but it came from the collection of all those stories. It really came from our, work for me? No? Okay. It came from our, well, for heaven's sakes, you just don't like that at all.
There you go.
It came from our collection of all those stories. So I wish I had time to share with you the raw data that we collected, the stories that people told us about the ways in which they felt they were a partner with their healthcare and the ways that they felt that they weren't. Some things as simple as courtesy, other things as profound as simply incorporating what a family member knew about their patient that was either listened to or ignored. A wonderful story that we had a lot of fun working with about someone who wrote a letter to her care team before a major surgery. And the result of that was well, really a change of experience, so that she had sort of created the partnership. In any case, all of those stories collectively, we went online to collect. We asked them those questions. We used a snowball sample, which really snowballed, and is the beauty of the patient and family network. Because certainly through the Society of the SPM and others, it's very easy to find those stories, to collect them, to see them build online. The issue, though, was our ability to go beyond simply the collection of stories and allowing individual stories to touch us, to move to a place where the collective of the stories tells us what changes must occur. And that's what we're most interested in, and that's the conversation that we want to have today around our ability to use stories that create change. We have to think about patient and family stories beyond their ability to just create empathy. We really have to think about them as collective action. But that means that we have to help patients and families tell their stories a little bit differently. We have to enable patients and families to understand where the key issues are of their experience and how to relate that experience into a very clear ask. What do we want to change? And how do we want to change it? More importantly, that's beyond an individual story's ability. It's our role of collecting them. So the two questions that we're going to come in this morning to ask and invite you, I'm going to have each panelist talk for a few minutes, and then we're going to open up to a discussion. The two main questions that we're interested in is, how can we help use patient stories in some collective manner to bring the system changes that we need? And second, how can technology help us in this task? And so part of what we're going to try to look at is, again, I have two amazing storytellers, active bloggers, active work, a top journalist, who have really used their skills in storytelling to create some amazing change. So I want to share their perspectives and have you hear what they have to say. Paul, who has been using technology to collect stories to make a whole lot of different changes, and that we're bringing over to help us make changes in healthcare. So I want you to hear from them, and then we'll open up to try to hear what we can do and how we all can utilize our stories in a more effective, productive way so that we create the world we want to live in. So let me start, if I can, with Casey, if you'd begin. Anything? So I'm going to let, again, each person's going to share just a little bit, and then we'll go to our discussion.
Okay, well, I think I'm going to give just a little bit of an overview of where I come from and what my purpose is and why this work attracted me. I am a patient, and I was a caregiver for my parents and also an advocate before they needed my direct hands-on management. I had my own cancer journey, and I wrote a book about that. So yeah, I got that story thing going on. But I'm also a journalist, and I work in hospital medicine. I produce a podcast for the Society of Hospital Medicine's Hospitalist magazine. So I am listening to stories from all points of the compass in the healthcare system. And the thing that it's like that last mile thing, it's like once we all start telling our stories together, patients, providers, system players, payers, once we all start telling our stories together instead of in silos, that's when the change will really happen. I think we've reached an inflection point where there's this, this sort of the continuum of doing to, doing for, doing with that Tom mentioned. We're at the inflection point now where I think we're pretty solidly in the for, and we're moving toward the with. And these ongoing conversations that are the stories, not just of the patients, but also of the other parts of the system, because it's important for doctors to tell their stories. And that's the power of events like Medicine X. And it was pretty awesome, if I can just say it, the convening of this project in DC back in February. I mean, I was blown away because Peter Pronovost knew who I was. And that just said, okay, the change is happening. And I'm just dedicated to continuing driving these conversations, going beyond just story, because patient stories are important. But I think that we can get stuck in patient stories with harm and bad stuff happened to mom or whatever. But I think moving past that and talking about what our outcomes and our desires are for our lives and how we want our care to unfold is as important. And the only way to really communicate that is if all parts of the conversation are participating. So then we're back at the participatory medicine thing. I'm done.
Thanks, Casey. Jeanne?
So I'm Jeanne Pinder. I'm the founder and CEO of clearhealthcosts.com, bringing transparency to the healthcare marketplace by telling people what stuff costs. And this was a really interesting experience for me because in the startup, we sort of all, people who contribute their stories and people who come looking for our information generally agree that transparency is what we're all about. And telling stories about their bills, bad things that have happened to them in the EOB process has been very revealing. Everybody's got a story about that. And we're kind of all moving in the same direction. With the patient engagement, there is an element of people telling their stories. People are passionate about their stories. Of course, we are storytellers. Since 40,000 years ago around the campfire, Homer the blind poet, reality TV, we are storytellers and we bring our passion to these issues by telling stories. The interesting part of this was holding up a mirror to the people who had contributed their stories and seeking to unite those stories into a roadmap going forward, where there was, interestingly enough, a multiplicity of opinions about patient engagement. What is it? We even had some people who said, we don't want to talk about patient engagement. We don't even like that phrase. It makes it feel like it's us versus them. We had people who said things like, I haven't heard anything new here. We've been doing this for 20 years. And that was, hearing that, listening to that, and holding up a mirror to the people at the micro-convening, the convening, and the people who shared their stories, and then welding that together into something that looked like a roadmap going forward that everybody could agree upon was really interesting, very challenging as a journalist. And, as a member of this team, which was fascinating.
Thank you. I have to just tell you, I adore these two women with all of my heart. And if I could
mutual fan club.
If I could do any other project with them, I would. But what was particularly interesting is that I think both Casey and Jeanne bring to this experience. Jeanne brings, again, this wonderful issue about cost. And cost is a very different story than the safety story or the patient care story. And so it's been particularly fascinating to interweave your knowledge about cost. And I have to say, this is going to be an ongoing project, though we did our compilation for this purpose. This idea of collective storytelling is something I think we're going to partner with I hope, for a long time. And so telling the cost story, which has preoccupied a lot of my time in the last 6 months since working on this project, we understand there are very different stories, and they're harder stories to tell because we're telling stories a little bit out of school. We don't really know everything about cost mechanisms. So Jeanne's work is so critical because as people start to get, through transparency, a real knowledge about that, our stories about cost will change pretty dramatically. So that's extremely exciting. Paul King, I'm going to turn things over to you as sort of give us the technology side and tell us about try to help us answer the second question.
Do you want me to
Tom.
hold your prompter? I used to run teleprompter in a news studio.
I think I'm good, thanks.
Okay.
But I am going to use a little bit of technology to help keep me on track. Storytelling is ubiquitous. Think about that for a moment. Every culture on the planet tells stories in one way or another. These stories are told in many different languages, using many different traditions and storytelling techniques. But storytelling in its many forms meets the fundamental human need to be connected to other people. Despite my English accent, I grew up in Ireland. Every culture tells stories, but the Irish have a culture that is particularly rich in storytelling. When I was growing up, everyone told stories. My family, our friends, strangers in the pub, everyone. When we had parties, you had to be able to either sing a song, play a musical instrument, or tell a good story. Those stories connected us, told us who we were and where we came from. Some of them were even true. There is an old saying that the Irish never let the truth get in the way of a good story. So good story is a powerful medium for connecting people, helping us to feel a part of a community by sharing what's important to us. That sharing is important, particularly when we talk about engagement. When we tell a story, we share part of ourselves. It's one of the ways we build trust. Traditional storytelling is great for those of us who take in information well, audibly. The play developed as a way of augmenting the narrative with visuals, and digital storytelling is a further development allowing the use of multimedia to tell the story. Audio, music, photos, video, etc. Good digital storytelling uses those multiple media in a way that expands and deepens the story, but the fundamental ways in which good story is constructed haven't changed. I'm sure that we've all seen great examples of digital storytelling and awful ones. So technology doesn't magically create a good story, but it does create some significant new possibilities. Most definitions of digital storytelling describe it as simply telling a story using multimedia. I'm interested in that, but also in a broader definition of digital storytelling that can be described as technology-enabled storytelling. There are some fundamentally different things that technology enables us to do that traditional storytelling cannot. These things are based on technology's ability to remove two barriers to connection, distance and time. Connecting people and communities that are distant from each other is the first. People that would previously never have met or known each other can share their stories and share them at scale with potentially millions of others. The second is the ability to contribute story over time. So the storytelling moves from being synchronous to asynchronous. These capabilities, combined with an increasing access to not only smartphones, but even basic text-capable phones, open up numerous possibilities, including the ability to contribute stories as they are happening, to co-evolve stories, and to find others whose stories echo your own. These are powerful community-building capabilities. I look forward to discussing them in more detail with you today. Thank you.
Thank you. Good. So one of the questions that we're going to try and talk through here is, again, how we can sort of assemble that. I'm going to share with you at the end here a bit of our plan on how we're doing that, but I think several of the pieces that are most critical are where I want to discuss. So, Casey, Jeanne, you've heard lots of stories here at many other conferences and in listservs and everything else.
All over everywhere.
And certainly in our collection, you saw quite a number of stories. What to you distinguishes that story from being a story that is touching, perhaps, or one that moves to some action?
Well, I'm going to go off in a slightly different direction here, but it's still going to be story. Is there anyone here who's involved in patient satisfaction scoring? They're doing press games or
HCAPs?
And any of that. Okay, well, the thing that I will say that I find like laughable, to put it politely, is that most of those patient satisfaction survey score tools are sent to patients up to 90 days post-discharge. Who remembers? And what Paul was just talking about, and enabling the tech, why is that not something that can be deployed as part of the discharge process? Collecting those stories in real time would allow the system to get immediate feedback on areas where they needed help. So I think that looking at storytelling as an immediate need and an immediate tool that can be used by all parts of the care process, from the patient to all parts, but you have to look at it as something that you want to do in real time. So let's figure out how we can make that happen.
Which is easy as goodness to do. Right? So quite honestly.
But again, we are arrayed against a rather large business model, because I know that Press Genie and HCAPs are not exactly tiny little capitalized little mom and pop things. So we might need to go and talk to them a little bit and make friends.
So a good example of this is recently helping someone navigate their own hospital stay, having a really awful experience, knowing that we were still in the middle of it and wanting to remedy it. Immediately I go down to the patient relationship office, which has various names at various hospitals, and this was a top award-winning hospital, and said, I need to tell you what happened yesterday and how it went. I need to tell you the story of yesterday. And by telling you the story of yesterday, my goal is to make it not be tomorrow, right? Or today. My goal is to intercept it, but my long-term goal is to get you to say, in this story are 6 things that have to change, not just for this patient, but in your system. And instead, the staff didn't know what to do with that story. Right, and so I think Casey's point is brilliant, because it suggests we have to change a system where we help healthcare hear a story not as a complaint and not as a woe is me, but as a
connection, as a connection opportunity.
Right, are things to do. Jeannie?
So one of the things that I thought was most interesting about the micro-convening, and then about convenings like this one here, is people's varying abilities to tell stories and varying abilities to listen. So, for example, if you read Charlie Ornstein's King Drew series for the LA Times, you would be sobbing, as I was. Not everybody can tell the story the way Charlie does.
Yep.
But being able to see that and hear that, and to also understand that people who are telling their stories might actually have just come from the most horrifying experience of their life, or that they're reliving a parent's death in front of you, and maybe are able to bring you to tears, maybe they're not articulate. And that was a really important thing for me, like listening, understanding people's varying abilities, and then also taking off our own blinkers and our own glasses, and being able to see through somebody else's perspective. Like maybe they're too sick at that time to actually be the activated, engaged patient that we feel like we might have been. Mm-hmm. Or maybe we were really upset when that person was like, why are we talking about patient engagement? We don't need to talk about patient engagement, which was sort of a repudiation of everything that we were doing. It was like, that was kind of rude.
We still gave them lunch.
But knowing where people are coming from and listening to that and being aware of that, because in the multiplicity of human behavior, we're not all the same. And that's the whole value of the storytelling experience. Synthesizing that into a roadmap was another thing entirely. But the listening piece is so important. Journalists have it.
Yeah.
Not all of us are born to that, but it's the thing that I think we need to really focus on in storytelling.
I really appreciate your saying that, because I do think, for example, going back to my example, having someone who was a storyteller, the patient could not do that. She couldn't tell the story about what happened yesterday. She needed a storyteller to tell that. And so our strengthening our families and our caregivers in storytelling is as important as doing that for our patients.
And some people are just really gifted that way. I'll never forget listening to Laura, what's her name, at Fu, talking about learning how to take care of her father who has dementia, he's bedridden, and how the hacking healthcare thing with Susanna Fox led them to the discovery of this massive spatula that's used in restaurants that you can use to flip an elderly person in bed.
Yep.
Like this visual picture. She's a very gifted storyteller. Not everybody can do that.
So, Paul, I'm going to turn to you because one of the things that we're interested in is not just how we get stories up or in through technology, but how we get them connected to one another. I know you've had specific experience doing that on some environmental work. Can you talk a little bit about that and help us envision how we can use technology to connect these stories together?
You bet, absolutely. I can give you some examples, and this is happening actually in many, many different places, so this is only one example of it. But one of the ones that I'm particularly impressed with is an organization called globalforestwatch.org. And the way that they have done it is to essentially create a global map which shows all the forests around the world and to present information about those forests in terms of what's being done in those areas, whether it be clear cutting or whether it be positive things like regrowth. But what they've really, the breakthrough is they've enabled people to contribute their own stories and do it in real time. So if someone's wandering around a forest, providing they have connectivity, of course, with a smartphone, they can actually take a picture of where they are, of the incident that they've discovered or a particularly beautiful scene in the forest, upload it to the site with their story about that picture or video. And immediately the technology takes care of all the housekeeping of geocoding the information and placing it in the right place on the website. This sort of ability to, in real time, create story and to connect you to something that really happened, it makes it more real for people, and I think creates a much stronger connection. That's just one little example. Actually, another example is some work that my wife is doing. She's with a nonprofit in the Pacific Northwest, a nonprofit, strangely enough, called News Stories. And this nonprofit's aim is to actually help us tell new stories about, instead of repeating the old stories, how do we actually engender change? We change the story. And they're working on a project for the Salish Sea region, which is interesting because it extends not just from Washington State, but up into British Columbia. So, and the First Nations peoples who are scattered across that whole area, and helping them to tell their story about the area and the land, and then melding that with the story of more recent arrivals. And using the same sort of techniques, allowing individuals to contribute stories, but also using that technology capability to create community around those particular areas and causes.
Thank you. So two great examples of ways that are very different than what we're doing right now in our systems of public reporting. And trust me, we do a lot of work at AAR testing some of those public reports of quality and safety. Imagine instead a system that showed a map and said, I'm interested in a hospital in the San Francisco Bay Area, and I click to the San Francisco Bay Area and see a collection of patient experience stories.
Yeah, like a heat map. Yeah.
Exactly. The possibilities are really endless, but it means we tell different stories. We tell our stories a little bit differently, and we certainly collect them up a little bit differently. The way we're approaching this at the Center for Patient and Consumer Engagement at AIR is that we're just starting a collection of stories that we will continue to try to connect together. We have a patient engagement blog, which is a little bit more of a thought piece, but what I want to show you is our on-the-ground solution. That on the ground is actually a collection of stories that we collect from patients and caregivers, and it enables us to sort of be able to tell people's stories. My favorite is one from a patient partner in Humboldt, California, who talks about the experience of that. The roadmap that we have coming out is a digital product. So it's an interactive PDF that allows for people to come on and make public commitments. which we can then follow up with in this technology to turn back into stories of engagement. What worked? What didn't work? How did it work? What was that experience like? And again, to create a network of those stories so that we can see change occur and we can turn experience into some form of action. We have a few minutes left. I want to open up to any questions, comments, thoughts that you want to ask of the panel or of anyone, and open up this discussion.
I just think it was really interesting, Casey, what you talked about real-time feedback. Two things sort of struck me. One is every conference you go to, measure the filters out immediately while I'm fresh inside. Second thing is, we could learn from the NHS system in England.
Yes.
Yeah.
Friends and family program. The NHS website, and instead of just showing, it actually shows comments. And think about Hospital Compare, which is the Medicare website. Nothing like that.
Sorry.
Comment on your experience there on the government page of what happened in the hospital. What they found with the NHS was when you did that,
That's right.
the biggest problems was parking.
Yep.
And they all then dealt with that, and it just existed forever.
Can I say something about that?
Go for it.
So what's interesting about the NHS system and what you guys are doing at on the patient harm Facebook page, it's kind of like what we're doing on Price Check, which is to create a place that people can talk online about a specific topic, and that those stories can be mosaic pieces, kind of presenting a picture for anybody to come in and look, be it the contributors or third parties. So what we found, some of you have heard me talk in really exciting tones about what happened to us at Price Check. We're putting prices online and people's stories about prices online. We have a crowdsourcing experience here in the great state of California with the two big public radio stations. We thought we were doing this for consumers so that they could go and look at pricing information and know what stuff costs, or what their insurance company is paying, or what's being charged. What we realized actually this past week was that industry figures are looking at this with great interest and acting on it in their own ways to their own particular benefit or detriment, because they're seeing information that we've just put out there in public in very much the same way that the patient harm community has given you leads for stories, but also I see industry figures going and talking, doctors coming, pharma coming, so that in a way, just making a place for people to tell their stories is a hugely powerful thing.
Yes. One of the challenges you heard yesterday from the e-patient presentations, I thought brilliantly said, was we all have a story and we have to have the courage to tell our story. I think that's absolutely correct. I think what we're suggesting is let's add one more component of that. Let's tell our story in a way that identifies change, that identifies what needs to be fixed. Let's turn our experiences, positive and negative. So the one piece we haven't yet talked about is the need for us to tell positive stories, to tell stories about wonderful. And again, I'm going to call up this, really what's become my favorite story of all time, from this wonderful woman, Toni Martin, who talks about being a patient partner, sitting with her doctor in these conversations in a boardroom and realizing, oh my goodness, I keep asking my doctor to take away my fear. And my doctor can't do that. Yeah. And it wasn't until these kind of negotiations that she was able to sort of see, I get my contribution to it. Now, she could write 100 stories about how she left the doctor still afraid. But what happened was she was able to get into a conversation and then tell the story of a renegotiated perspective for both of them, actually. That was extremely powerful. Yes?
I think it would be a really good idea to collaborate and share the other resources.
Yeah.
All the different places online where patient stories are being told. I recently was trying to find
Yes.
But that's only looking at one.
You're sitting 2 seats away from the dude who can give you more details on that than you can believe. You got a fire hose there, red shirt.
All they look at is Medicare patients. I'm like, there are so many more people that go to the hospital than just
Yeah.
Medicare patients. It's not fair to make
That's
patients
right.
just on Medicare.
Yeah.
So there is a need, by the way, technology developers to start developing these kinds of sites that enable us to get to those kinds of resources. And to create these kinds of very powerful resources like what Paul's talking about in the forestry work, we could be doing in patient work very easily. Yeah.
So I struggle with whether to say this in this forum or not, but I
Sure.
feel compelled to do so because you keep talking about wanting to change these stories, turn these stories into action.
Yeah.
And I don't want this to turn into an infomercial about the company that I work for, but I'm going to throw it out there anyway. So I work for a company called Edison Nation Medical, and the whole goal of what we do is to enable patients, caregivers, physicians, nurses, to take their ideas for improving healthcare and actually bring them to life.
Yeah.
And I think one of the biggest challenges that I have as heading up marketing is to convince somebody that they're an inventor. People don't think that they're an inventor, that their idea is worth anything. They just know that they have a pain point experiencing it. They don't necessarily take it one step further.
Right.
And to your point, I think it was kind of eye-opening for me to hear you say that a lot of people have a hard time even articulating. And I think that's even one step before somebody being able to identify that they're an inventor, is can they even articulate what their pain points were? They just know they were frustrated, and they don't know how to express that because they're in the moment of illness.
I've got something for you. An infomercial for myself and for everyone else like me. Bring in some savvy patients who already know the game, help you build that connection.
Yeah.
Because those of us who have been doing this for a while and who do it, I mean, when I say business, it's, obviously I'm not making a fortune on this. Don't think so. But it's important work. And for those of us who've walked the walk and have some intel, leverage us, use us, because we can help bridge that gap.
To your point's such an important one, and really the first step that we're discovering as well is that, and you've heard them even here, there are many productive stories and some less productive stories, and empowering a patient's story to say, so what do I want? And what do I vision? That's why we did a vision video out of this. Yeah. Because what we said was, your issues, your experiences, good and bad, are lovely to hear and very compelling, but the question is, so what's the ask?
Yeah.
So we have a task ahead of us, all of us, to help patients and families tell that story differently.
Yeah.
And again, when I say differently, I really don't mean tell a different story. It's your story. But in order to add to that the creative vision, say, in a perfect world, what I'd love to see happen, and then we can create it.
Because frankly, the system has not been listening to patients until recently. So this is terra nova.
Yeah.
But the more we talk about it, the more we engage with each other, the less sort of walls between us there's going to be.
Exactly.
And some of those ideas might end up being process change. Some of
Yes.
them might be new service lines. Some of them might be new devices that come out of it that could impact patients all over the world.
Or some of them may be a different perspective that helps someone navigate the system differently. Yes?
I guess would like to give a Swedish reflection.
Yes, please.
I'm managing quite a new national initiative embedded in public health care. Some of the interest also by experience based design. What we're trying to do is to bring in design tools and methods on people's experience.
Beautiful.
Yeah.
And started up in October. What I'm thinking is that there's a big difference regarding that. Most of the stories I can see around. What faith and it must be much more connected by also because they have the power And if you start inside with some
Yeah.
describe those problems, you need to
That's correct, yeah.
collect the insights.
I think we're learning the exact same thing here, yeah.
There's a lot of experiments.
Beautiful.
More directing the phases will be in patients.
Yes.
And we have projects sort of not that close more towards
Yeah.
Thank you. I'd love to get your information and watch you do that. Yes.
When I get back to my computer, my question is around sort of. Are you, I mean, review process on low literacy patients that are using multiple visually, as you said, blogging, make it semi-structured questions. Curious, what are the ways?
What we did for this process is we did a very, very simple online open survey. And we sent the URL around to folks and said, just tell us your story in any way you want to, need to, in any language capacity that you have. We really made it very, very open and very simple and very easy. But again, as we're sort of just at the start of this, I think those are the critical questions that we have to ask, and we invite other developers to ask. What are the best collection tools? How do we help people frame? How can we mentor people in their storytelling while we collect it? Mm-hmm. How can we intercollect it? And how can we synthesize it? Because I think there's a whole synthesis piece here. And I think we're understanding that there's a role for some of us in healthcare policy and research particularly, which is why we've taken this on, that's what we do, in synthesizing what we've collected into something that becomes actionable, like the vision video and other things like that. So again, I think we have a lot of collective learning to do, and why I love talking about this at a place like Medicine Nexus. I know our minds will come together and we'll wind up emailing together and making some of those connections.